This was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time. Welcome back to Wellness in Dentistry. Today we're going to be talking about a subject that nobody wants to talk about, which is getting sued in dentistry. Litigation, it's a nasty word, but it's something we need to consider. And so we're going to talk about some of the statistics. We're also going to talk about the emotion that can come with that, how realistic it is, and maybe even how to overcome some of these emotions. I'm someone who has gone through this, so I'll tell you some of those stories. And if you're not familiar with us, I am Dr. Kyle Stanley. I'm a dentist, tech entrepreneur, speaker, and researcher. And I'm joined by my co-host, Dr. Martin Mendelson. Martin is a disabled dentist, coach, speaker, and author. And his first book, One Move Makes All the Difference, is awesome and is available wherever books are sold. Together, Martin and I have helped thousands of dental professionals pursue wellness and dentistry. And so we're excited to talk about this subject today. Martin, it's a challenging one.
It's a challenging, yeah, it's a hugely challenging one if that's terrible English. But that there's the reality and there's the psychology, and the
Hmm.
reality really sucks, and the psychology is really difficult to deal with. And so it's really not an easy subject. So I'm glad that we're, shall we say, taking the risk to jump into this one because this is a hot topic. It really is.
Yeah. I want to talk about some of the prevalence that
Yeah.
I know, some of the statistics. Okay, so I'm reading it over here is case volume. One study found that dental malpractice accounts for approximately 12% of total medical liability claims. That sounds like a lot to me.
Mm.
All medical liability claims, 12% of them?
Fair. Okay. But what about severity?
It's a great question. Yeah, let's keep going. Risk factors. A 6-year analysis revealed that dental practitioners had the highest rate of complaints among 14 health professionals in the study cohort at 42.7 per every 1,000 practitioners annually.
Hmm.
Male practitioners are often found to be at higher risk of complaints. And conviction rates in dental malpractice cases can be high, with some studies indicating they can exceed 60%. That was from the NIH. Now,
Okay.
the common causes of litigation, and I'm sure everybody knows this, as far as volume, the biggest causes are pros, so like
Hmm.
54%. Now, you're probably thinking that's less risky, but we have to think about it's the most common procedure done in dentistry,
Yeah.
right? Is
Yeah.
a crown, for example. And then dental implants is second to that at around 20%. Now, the reason for claims usually include incorrect or incomplete treatment, misdiagnosis,
Hmm.
failure to obtain informed consent, and treatment delays. Maybe let's stop there.
Hmm.
And I want to get your thoughts on some of those.
Well, I think it's, to be fair with you, I think it's only half the story because
Yes,
it may account for what did you say, 12% of all medical malpractice.
right,
However, if you're suing your dentist, you're suing them for a hell of a lot less money than an orthopedic surgeon.
right.
So we got to take this with a grain of salt, right? Um, because the truth of the matter is that the judgments, or the amount of money that people have to pay for these suits is going to be a lot less than on the medical side.
Yes,
Doesn't make it any easier to deal with, but it's just
correct.
it's a reality. I mean, look, the challenge psychologically is bad enough, and we'll talk about the psychological ramifications. That's bad enough, but then if you add on top of it a true realistic threat of losing everything, which is not the case, well, that would make it even worse.
Yes.
So again, I think we really need to look at both sides, frequency and amount, and we need to get real about what are the real ramifications here in the
Yeah,
end.
the other thing, just to let you know, what this says is these are claims.
Correct. Yeah.
Claims is people saying things about you, right?
Yeah. Yeah.
Doesn't mean that they went through.
Correct. Correct. And I
So even if
challenge
it's
that.
12% of medical claims,
Yeah.
that doesn't mean that they all went through.
Correct.
Hmm.
Correct. And I'm curious, there was that one stat you gave that 60% of them end up having to pay. That seems high to
It
me.
seems high to me too.
Yeah.
And, I'm no expert in this, but having been in this industry, you and I, for a long time,
Mhm.
we know a lot of people who have been through this. I
Yeah.
have been through this, and that seems very high.
Yeah. Yeah. Yeah.
There's probably a lot that happen in the background that just don't go into these studies too, because they never go through, right?
Correct.
So it's
Correct.
one of those weird things with research where if you just read the final, if you just read the
Mhm.
discussion or if you
Yeah.
just read the summary, you
Yeah.
don't get the full story.
Well, and the truth is that, the we need to be good, I'm going to use a word that I think I just made up, documentarians. Is that a word? We need to be good
I'll allow it.
yeah, we'll work with it. We need to be really, really good documentarians. If nothing else, I used to use the following philosophy. If I got hit by a bus, would somebody be able to pick up the chart and understand what the hell's going on?
Hmm.
If the
Yep.
answer is yes, then great. If the answer is no, then Houston, we got a problem. So, you need to do that for continuity of care anyway, because it's the right thing to do. And secondarily, particularly when you have a challenging patient, if you have a situation where everything is documented both in writing and in pictures and in radiography. You get the approval for, the go ahead. You get the signature that they accept the final restorations, and then they come back and sue you. Well, that's going to be a hell of a lot harder of a road
Yes.
for that patient to have the case go through than if you didn't do that. And
Well,
so,
let me tell you a story about that.
yeah, yeah.
One of, I've been threatened to be sued twice,
Hmm.
neither of which went to trial.
Hmm.
One of them, we gave some of the patient some of their money back, and she
Hmm.
kind of went away. Another one was sued by a team member.
Hmm.
Okay. We settled it in arbitration.
Hmm. Hmm.
Okay. We didn't do anything wrong, except that we didn't document the things
Yeah.
we did right. So when you think about it, it sucks that we had to settle this in arbitration and go through all the time and effort and all the stuff that happened. But looking back in hindsight, it was a great learning lesson
Yeah.
on documenting
Yep.
employee things.
Yeah.
Let me give you a little bit of the story, but she basically claimed that she wasn't getting her lunch breaks.
Yeah.
And in California, you have to have a specific time for lunch. They have to clock in, they have to
Mhm.
clock out. You have to have that written down. You have to have proof of that.
Yep.
And we didn't have the proof.
Yep.
Now we do, because now it's all done digital. It analyzes their face. It's like there's no questions about it.
Yep.
So it's exactly what you said.
Yeah.
You have to have it documented. And if it's not documented, then it didn't happen. And I know that sucks because I call this defensive dentistry, whether it's defensive dental management or defensive dentistry, clinical dentistry. But once I went through some of these, I started thinking about if someone was reading my notes or if someone was reading my employee um, folders, would they know the real story?
Well, is there an opportunity then to reframe this whole thing like I was just saying before? Is it that we're playing defensive dentistry, or is this an act of care? Team stuff aside.
Yeah.
Let's focus on patient.
No, I think it's an act of care, but like When
Uh,
my dad talks about this from the 70s, he was like,
yeah,
we didn't have to document any of this stuff. Like, we
yeah,
just put crown on number 15
yeah,
and
yeah,
no one got sued and it
yeah,
like wasn't a problem.
yeah.
So it would make dentistry much more enjoyable if we didn't have to do all this extra crap.
Fair,
I feel like
fair.
that impacts burnout so much is
Yeah.
constantly thinking about, did I write every little, I didn't use the full carp. I used or cartridge, not carpule. Did I use the full cartridge or did I use, three quarters? That could be the difference
Yeah,
in like, me getting sued or not,
yeah,
right?
yeah. Well, I think part of that too, especially these days, and particularly with AI, um, full chart notes that, there's a lot of systems that we can employ and
It's getting
deploy to help
easier.
us. Yeah.
It's
Um,
like the requirements are getting higher, but with that, the technology is improving at the same
yeah.
rate.
Yeah, yeah, yeah. But let's I'd love to at some point, unless you want to continue on the statistical part, I'd love to talk about the behavioral elements of this.
Okay,
Um,
sure.
because there's a lot to it. And I was thinking about this and there's a lot of wiring that's going on here. So like the first thing is, we're wired for worst case scenarios. We have an implanted negativity bias. And
Yep.
so,
And
you
that's
know,
to keep us safe, by the way.
yeah, and so, like anything else, it to a certain level, it's good, and then if it's overused, that goes into different territory. Because you could be in practice for 20 years, see thousands of patients, have zero issues, and then you hear one story from your buddy down the street, and you're freaking out,
Yeah.
right? And so our brains don't ask, how likely is this? Our brains are going to ask, how bad would this be if it happened to me? Right?
Hmm.
And so malpractice goes into primal fears. It goes into loss of income, goes into loss of reputation, loss of identity. So it becomes this like triple threat, right? So that's kind of the first thing. The second thing is that dentistry is a very personal thing. And, I'll use the P word in this context, even though I hate it, also permanent. Because you're working, inches from somebody's face,
Yep.
the patients are awake, the outcomes are visible and emotional. And so when something goes wrong, it's very hard for us to say it's a technical issue. It feels like, kind of like we hurt somebody, right?
Right. Well,
Um,
we're working on people's bodies,
yeah,
which is like such an emotional thing for us and for
yeah.
them.
Yeah. Not to mention the fact that perfectionism is baked into our entire damn profession, right? We see in tenths of millimeters, we fix tiny imperfections, we strive for ideal outcomes. And the truth is, stories travel faster than statistics, right?
Hmm.
So, um, one lawsuit story is going to travel farther. And honestly, on the patient side, that's the case too, right? Because, for example, root canals have a terrible reputation within the confines of the patient population, right?
Right.
But the truth of the matter is, we all know that there's many, many, many root canals that have been accomplished, including in my own head, where it's pain-free. But you don't hear about those.
It's so funny. I talk about that all the time too, is like how people associate the pain with the root canal on the pain before the root canal
Correct.
and not afterwards.
Yeah, yeah, yeah. Totally, totally, totally. Right. Um, so I mean, there's other stuff we could talk about too, but like loss of control is terrifying, and of course the identity threat. Like if we get sued, that means we're a shitty dentist,
That's what
right?
I want to talk about
Yeah. So
too.
let's talk about that one.
Yeah.
Yeah.
Because I used to think that only bad dentists got sued.
Hmm.
And I remember the first dentist that told me that he was sued was my partner, Mark.
Mm.
Mark is the guy that we bought our practice from that was planning on retiring and then now has been with us for 13 years. He's an incredible dentist and he's like amazing hand skills. Like one of those guys
Hmm.
that just has amazing hand skills, right?
Hmm.
Great guy, easy to talk to, good looking, like he's got it all. And I remember when we first started practicing there and he was telling me about one that he had gone through. And he told me how, he lost sleep over it. He missed his kids' games. He wasn't there for his spouse at the time. And like, he really went through it all.
Hmm.
And I remember thinking, like, Mark, you got sued? Like,
Right.
that's so crazy. And I can't even remember what it was about, but I remember it was kind of a nothing thing. It was
Yeah.
like, oh, wait, she sued you over that? Like,
Mm.
crazy. So that was the first big wake-up call for me was it's not bad clinical dentists that get sued. No, sometimes it is. Don't get me wrong,
Yeah.
right? Sometimes there's hacks out there that are giving us all bad names. But in general, usually, and it's from my experience, it's going back to what I always say, boundaries, expectations, and communication.
Yeah.
And it's like if you can do that early, you're going to prevent a lot of this. So, okay. So that's the fact that it's not only bad dentists that get sued.
Hmm.
I think the hardest part for me was I thought, but I'm a good dentist. Like, I can't be getting sued.
Yeah.
I was the one, when I was threatened to be sued for one of these large implant cases, I was the one going around the world teaching people how to do this stuff.
Yeah. Well, there that goes to the identity piece right there.
Yeah,
Yeah.
exactly.
Yeah.
And so I was like, I did guided surgery, I did digital smile design, I was using the best implant system, I was using this and this and this. And she just didn't like it.
Hmm.
And I'll tell you, my dad said something to me that I think is half right and half wrong.
Hmm.
He said, people won't sue you if they like you.
Yeah.
And, a lot of it has to do with how you are perceived by the patient.
Oh, 100%.
I know I've had friends that have told me stories or they've gone through things. Most of the time when patients sue you, it's because they think you don't care
Yeah.
or they think that you did something wrong and now you're not calling them back. Now you're,
Yeah.
only
Yeah.
letting your front office do it or,
Yeah.
something like that. And what's funny is once you connect with people, and again, I learned this the hard way. Once you connect with people and they know you care, they're
Hmm.
much more likely to work with you.
Yeah.
An example of
100%.
this is we've gotten some negative reviews at my practice.
Hmm. Hmm.
Most of the time they're silly. We got one negative review because we didn't take their insurance, right? We got another negative review because they didn't like, oh, because they had to pay up front to book an appointment, right?
Hmm.
What most people do is go like, oh gosh, like that's so annoying, and oh, these patients are so annoying. What we did was call the patient, get them on the
Yeah.
phone. I talk to them, or my partner would talk to them, and we've gotten these reviews removed because the
Yeah.
people were like, oh, you know what? I'm so sorry. I was having a bad day that day, and they
Hmm.
forgot about it that they even did it.
Yeah.
But this can really impact our business. And so it's like there's the identity piece. There's understanding that it's not only bad dentists that get sued. And I think the big learning, like the prevention way of doing this, is focusing on your soft skills, which is those
Hmm.
boundaries, expectations, and communication.
Hmm. 100%. 100%. Yeah. It's, I was going to say something similar relative to, the better of a communicator you are, in many cases, the less likely you are going to be to be sued only because, and that's a huge blanket statement, and I
Yeah,
realize that. But
but I think it's correct. I mean, unless you have a great communicator that is just a total hack, right? And,
yeah,
money
yeah,
hungry, greedy
yeah.
dentist. But
Yeah. Well, and if you are a good communicator, then theoretically, it's not just that you're communicating now that, the crap's hit the fan, but you've done it prior to that as well, right?
hmm.
Um,
Sure.
so it kind of goes back to my denture patient stories that, where I came up with that form because
Yeah.
I was providing, you know, or fabricating dentures in a stepwise process, the way I was taught, the way that I knew worked. And, these patients were coming in from these, teeth into day centers, which back then wasn't necessarily connected to implants. It was just you got a full upper, full lower in one day. And they'd say to me, am I getting my denture that day? So I got frustrated because I was tired of hearing that. So I came up with basically a checklist that I went over with a patient. I had them sign it. And then at every appointment, I'd say, okay, great. We're at appointment number two. Next time's number three. You have any questions? Blah, blah, blah. And the minute, and it did happen quite a number of times where they would still come in and say, am I getting my denture today? And I would just be like, well, let's check where we are, right? And it, in every case, shut it down. And they and were apologizing to me. They're like, oh my God, I'm
Mm-hmm.
so sorry. I'm so excited to get it.
Mm-hmm.
And I look at them and I go, of course you are, right?
Mm-hmm.
And we want to do it in a way that it's going to be, the best result, feel the best, blah, 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 blah. So, people frankly just want to feel heard.
Yeah.
And when they feel like they're not being heard, they get really angry. I'm in the middle of a situation right now. Um, I didn't even tell you about this, where it's an over-the-counter medication, or sorry, not over-the-counter, a mail order kind of thing.
Uh-huh.
And they changed how they ship from every 3 months to every 2 months, but they didn't change the price. And I'm literally going back and forth with these people going, the frequency is irrelevant. I'd like to point out that instead of three, I got two, and it's the same price.
Right.
I literally have put in there, why are you refusing to acknowledge the price versus medication amount discrepancy?
Yes.
So if I don't get a clear answer, I'm going to go to my credit card and give them all the chat because it's very clear in the chat,
Yeah.
and have them fight them for the
Dispute.
the difference.
Mm-hmm.
And I'm going to report him to the FTC
Yeah.
because they refuse to communicate.
That's right. Yeah, because it's interesting. And what you're talking about right now happens so often with dentists.
Yeah.
And many times it's not about what's happening in the mouth.
No.
The crown fell off after a year. Okay, well,
Yeah.
yeah, like, we could fix it and this. Oh, well, and maybe you're not getting them in fast enough, or maybe you want to charge them for something, or, whatever it is, or maybe you don't return their phone call. Then they start thinking, oh, well, it's not really about the crown. Oh, they just don't want to deal with
Yeah.
me. Like, and
Yeah.
then you start thinking, oh, well, what could I do to this person? Oh, well,
Yeah.
yeah, I guess I could report them to the board. I guess I
Mhm.
could get a letter from my lawyer.
Yeah. Yeah. And the truth is sometimes those conversations can be really hard to deal with. Like, for example, something that has a hefty fee associated with it that didn't necessarily take a lot of time.
Hmm.
And so patients often would be
Right.
like, why is it $2,000? It took you 15 minutes,
Yeah.
to try to exaggerate here. And often we don't answer that really effectively,
Hmm.
because, it's not about the time, and if it
Yeah.
were, crowns would be a whole hell of a lot more expensive. And
You're
so would
right.
everything else. It's like, hey, not that I would ever say this, but it's like, hey, you want me to charge you based on that time, per hour? I'm happy to do that.
Yeah.
So, yeah. So,
Yeah. I want to get the point across to people listening that if you've gone through this, you're not alone.
nope.
Many other docs have gone through this.
Yep.
More than likely, it's not going to ruin your life
Yep.
long term. You're not going to lose your license.
Yep.
And it will be a short period of time where many times you'll learn a lot of things. Like I'm actually looking back on it now, I'm actually thankful of the situations that I went through because it taught me so much.
Yeah.
And what's happened now is I'm then teaching a lot of the things that I learned to other people with my treatment agreement,
Yeah.
patient dismissal protocol, Lightside Academy, complication compliance method, your best year ever in
Yep.
dentistry. Like all of my courses have come from some of the bad shit that I've gone through, right?
It's true. Yeah. Yeah. Totally. Totally.
So, what are some final thoughts you have around litigation?
I would say that worrying about being sued every day is not the best use of your time. And what I mean by that is this.
Or your mental capacity?
Yeah, why not put that worry into action? Why not
Hmm.
put that worry into thinking about how can I best communicate complications with my patients? How can I best communicate, um, treatment results? How can I best document their acceptance of veneers or bleaching level or whatever? Not from a standpoint of defensiveness, but from a standpoint of completeness, right?
Hmm.
And so it's a subtle mind shift, but it's an important one because we're not focusing on the suit, we're potential suit. We're focusing on actions. I think that's number one. So it's basically a way to live your life. Also understand that the statistics are not necessarily in your favor relative to a suit being filed. However, see point number one, you'll be in a much better place if you've taken the time to document correctly, comprehensively, and completely, right?
Hmm.
And keep in mind that, like we were when we were all teenagers, where we thought one comment was going to end us for all time, it's like, how true is that? My favorite
Yeah.
question of all. So, again, it's not about never ha make it's not about avoiding it at all costs. It's more about understanding that it's a possibility. There are things you can do to mitigate the ultimate result, and that worrying about it on a daily basis has a very high cost that you may not choose to pay, I think is the way I would put it.
Yeah, my final thoughts on this, my main final thought is focus on what we can control and not what we can't control.
Bingo.
You can't control someone suing you.
Yep.
What you can control is, first of all, preventing it from happening as much as possible
Yep.
by being a great clinical dentist, having all your documentation done,
Hmm.
um, communicating well.
Hmm.
And then let's say, even if you do all that, but they do sue you, now it's going back to what you were saying. They're less likely to have a case because you've documented everything. You have
Yeah.
photos, you
Yeah.
have texts with them, asking how they're doing, communicating with them. All that stuff goes a long way. And when I was traveling around teaching people how to do guided surgery, one of the things that I used to say was, imagine yourself on the stand
Hmm.
and they're saying to you, okay, doctor, you place the implant in this wrong position, but you have the option of using things like guided surgery. Why didn't you do that?
Yeah.
That's why I was such a big proponent of it, was just
Yeah.
predictability, defensibility, right? So
Yeah.
like use everything you can to make dentistry more predictable.
Yeah. Yeah.
It lowers your stress, it lowers your patient's stress, it makes things more predictable. You make more money, to be honest
Yeah.
with you, and it makes dentistry more enjoyable.
Totally. Totally. Agreed.
Well, guys, I know this is a heated topic, and it's not something that's easy. And removing your self-worth from your clinical work is challenging, but it's something that Martin and I have worked on and have now taught thousands of dentists how to do. So if you're interested in learning how to do that, come to our live events, take our online courses. All the links are in the show notes, or you can go to wellnessanddentistry.com and check out everything. And we hope to see you on the next episode.
Bye bye.